Farmies, I have a video for you today on norepinephrine. So norepinephrine causes vasoconstriction, which is a narrowing of the blood vessels, so it's very useful for maintaining blood pressure in times of acute stress. For example, if your patient is in shock. So shock is really not this surprised look. It's low blood pressure and inadequate perfusion to your organs. So we have inadequate perfusion to all of these organs, resulting in ischemia, ischemia and tissue death, and eventually organ failure. So norepinephrine to the rescue. Norepinephrine is going to be the first line of defense to increase blood pressure. So it's a vasoconstriction, so it increases blood pressure. So what are our roles as a nurse? We have to monitor that blood pressure very, very carefully because this drug works in like 1 to 2 minutes. So we're going to very, very carefully monitor blood pressure very closely. We wouldn't want to give this if the patient already has high blood pressure because this is going to increase blood pressure. If their blood pressure increases too much when we give it, we just withdraw the drug very slowly, taper. As we are tapering the medication or slowing down the medication, withdrawing the dosage, we have to watch our patient for rebound hypotension. So just because we think we fixed their blood pressure with epinephrine, it doesn't mean we can stop. As soon as we withdraw the medication, their blood pressure could drop again. So we call that rebound hypotension. One other nursing intervention I want to point out, we talked a little bit about this in class for other medications, but if you're administering this medication IV and you're causing vasoconstriction and it infiltrates, you have an extravasation, you are going to give phentolamine because we want to counteract that vasoconstriction. Phentolamine is a vasodilator, and this will prevent tissue necrosis in your patient's IV. Alright, so norepinephrine given for shock fixes low blood pressure. Norepinephrine to the rescue, increase in BP. We're going to monitor BP and we're going to taper the medication very slowly, titrate the dose down to avoid rebound hypotension. Have a great day, Farmies.